those surveys as well, right?
Yes, I was.
Okay, awesome. Good.
Hey, Clara. I have a repair person here who's going to be finishing up in about a half hour or so. So when that happens, I'll have to step away. So I don't know if you want to do the data snapshot sooner rather than later.
Okay. Yeah, we can. Let me look at the agenda. Yeah, we can always start with that. Yeah. That sounds good. We'll do. Yeah, we'll wait till a couple more people get here and then we can start with that data
I
snapshot.
figured the timing was going to be he was going to come in and need my attention just as I was about ready to talk, because that's how life goes.
That's how it goes. Yeah. Yeah, no, we'll kick off with that.
Perfect,
If
thank
that
you.
works for you, Susan. Awesome.
Hi, Susan. Good to see you.
Good to see you too.
All right. So it's maybe a smaller group today, but that's okay. Do you want to get started, Clara? And we can just wait for people to come in.
Yeah, I think we can get started. Yeah, so I sent a agenda out this morning, but I'll also send a link in the chat in just a minute so that everyone has it. But today we're going to talk a little bit briefly about the community workshops we had. Susan's going to give us a presentation. The state had a consulting organization do a sort of demographic data analysis of sort of the makeup of Cumberland County. And I think this will help guide our outreach efforts. Then we're going to talk a little bit about the stakeholder interviews that we've been trying to gather. And then we'll end talking about the survey distribution. And I was able to get data on the Cumberland County survey results so far. So I can share some data from that. And it'll be good to see sort of which populations we're reaching and which we still need to. But I think that's it. Hi, Jen. Thanks for joining. Yeah, so I think we're going to kick it off with Susan. So Susan, I'll pass it over to you.
Awesome.
Susan, would it be helpful for you if everyone just gave a quick introduction?
That would be
Or
lovely.
do you know most people here?
I may have met you at one point, but I'd love to have an introduction. That would be great.
Okay, great. Well, I'm Emily from Greater Portland Council of Governments. And you know Deborah,
Sure.
I hear. Debbie, do you want to introduce yourself?
Hi, yes, my name is Debbie Condello, and I work for the Southern Maine Agency on Aging. I'm our our community programs coordinator. I'll pass it to Amy.
I'm Amy Stone, a library director at the Bridgeton Public Library.
And then I see Derek.
Hello, I'm Derek Moore, and I'm the contact center manager at the Opportunity Alliance and 211 Maine.
I'm going to see Nathan.
Hello, Nathan Davis, Director of Programs at Gateway Community Services.
Great, thanks for being here, Nathan. Jen.
Hi, Jen Albino Wood. I'm the library director at the Wyndham Public Library. Thanks, Susan.
Nice to see you, Jen.
And then I see Bob.
Hi, I'm Bob Zager. I'm the Chief Financial Officer at Greater Portland Health.
And then Bruce.
Hi, everyone. Bruce King. I'm the co-executive director of Maine Inside Out and a commissioner on the Permanent Commission on the status of racial, indigenous, and tribal populations for Maine.
Thanks, Bruce. And I think that's everyone.
Wonderful. Well, thanks, everybody. All right, I'm going to go ahead and share screen. And so what we're going to talk about today is a high-level view of the demographics for Cumberland County. This was prepared by a consultant that Maine Connectivity Authority contracted with. The organization is HRNA Consultants. And it's the demographics in relation to the covered population. So I'm going to go ahead and start us out. So You know, you've heard covered populations, important people in that we're focusing this digital equity and digital inclusion plans on. And so this is just a reminder that we're looking at some of the statistics as it pertains to the covered population. This slide, and we'll talk about some of these areas that are highlighted in the next slides, but this is how Cumberland County compares to the other counties in the state. This is, Clara has this in a PDF that she can, if she hasn't already, she can share with all of you. And you can take a deeper look at that slide. Okay, so we know in Cumberland County, there are 300,776 residents. These statistics are coming from the U.S. Census American Community Survey data. These are the 2021 statistics, which are our latest statistics that are available. There are 125,986 households. 11% of the population identify as non-white, and 9% of the eligible households in Cumberland County have enrolled for the FCC Affordable Connectivity Program. What this number does not tell us is the actual number of houses that are eligible of that 300,000. So at NDEC, we're working on those numbers, and we'll have some data that we'll be able to give to Clara and her team over the next few weeks. The breakdown of race, 89% white, et cetera, throughout for the racial and ethnicity breakdown. This slide tells us the demographics, male versus female, county versus state versus national, the age breakdown, and the educational attainment for the county. It tells us that 8% of the county meet the federal poverty guidelines. 1% of the population have limited language, English skills. 12% of the county identify as having a disability. 17% are 60 years old and older, and 7% of the population are veterans. One of the data sets that we're able to get, that we can get from American Community Survey, a broadband adoption statistics. So this slide is telling us that 7% of the homes in Cumberland County do not have any internet access. 89% of the homes that do have broadband have a computer in the house, and there are about 3% of the homes in Cumberland County do not have a device or a computer. Of those that do have devices, 4% have only smartphones, and we know that smartphones are just not enough for remote work or school and other functions. 1% have tablets only, and 86% have desktops or laptops. And then this final slide shows us that the family median income in Cumberland County is $80,700, and 44% of their income goes to housing cost. So I'm going to stop share there. Remember that I think it's always good to remember that American Community Survey data is a snapshot in time. And it's based on the number of people who have responded to the census surveys. But it gives you sort of a high level view of the demographics in relationship to the covered populations. And happy to take any questions. Okay. Great. So we are working at NDEC. We're working on the breakdown, the details behind this, so that we can give to a GPCOG to distribute, and it will show on a town by town basis all of these, the detail of the statistics, and as well as the county level. So we're working on that, and we should have that ready sometime in the next few weeks or month or so.
Amy?
Actually, Susan, I do have a question about the overview that you just gave us. So do we have any information on the number of residents who live in rural communities as opposed to urban?
Yeah, in the detail that we're putting together,
Okay.
we will have that information. We'll have that information.
Okay.
Yep.
Deborah had a question.
Yes. Hi, Susan. My question has to do with internet access, where it said on there percentage for internet access. What is the definition of that? Or is it a broad definition?
So the FCC identifies broadband as 25/3. So the American Community Survey data follows that same logic. So these are homes that have or do not have a 25/3 connection. So it is definitely, so we know that in the state of Maine, we considered unserved anything under a 25/3 connection.
Oh, this is Deborah again. Let me clarify my question. I guess I'm stuck on the word access. So access is in the ability to have internet. Access is in, do they already have internet? Access is in, are they able to utilize internet?
Yeah, so yes, the question is that what if they don't have, what if there's no broadband available? Right, right. And so my understanding with these numbers is that if broadband is available, that these are the numbers who are not subscribing.
Okay, thank you.
And again, was that number of people who have access across the state, was it 84, 86? Is that what it was?
Let me take a look. 85 across the state, 86 nationally.
Okay, thanks.
I mean, one thing this doesn't tell us is that, you know, pre-pandemic, you know, we looked at one device in a household, and in many households that was sufficient. Post-pandemic, that was not sufficient. You know, everybody in the household needed a device. So, you know, it's only telling us the one. So there's still a lack of devices in many homes that only have one device available.
Any other questions on the demographic data?
Well, so I guess my question is, so what does this data tell us about what we need to do next?
So it tells, for one thing, it helps in the number, like just in the number of homes that do not subscribe to broadband, or the number of homes that do not have a device. We can back into that number for budgetary purposes. So that's helpful. Also, you know, we know that we want to focus on the covered populations for the whole plan, but I think it's just helpful to know what exactly we're talking about. You know, how many veterans are there? And then in the detail that we'll be providing to Clara, it's actually going to break it down by town. So, you know, going forward with your digital equity plan, you might look at that town by town and say, you know what, we're going to concentrate on getting people signed up for the ACP benefit, for instance, in a particular town. The data that we purchase also includes the number of homes that meet the federal poverty guidelines of 200% of federal poverty guidelines, which if they meet that guideline, they're eligible for the ACP benefit. So this data it's good, but it doesn't really get into sort of the meat of everything. And I think that that's really more important as you move your plan forward. So we're going to provide that too.
Deborah?
Yeah, Susan, you shared it at the beginning, but I forgot the answer. When was this data pulled?
So it's 2021 American Community Survey data.
Thank you.
Yeah, that was just released in January.
Thank you. That's helpful. I just wanted to make sure.
Yeah.
I knew we were dealing with updated data, but I just couldn't remember if it was before COVID or after COVID, or, you know.
And I think 2021 is fine, but you know, a lot's happened in 2 years in the broadband world. So, you know, again, I think you just take this all with a grain of salt and sort of this is where our starting point is, and everything we do from here on up is going to be a win.
Perfect. Thank you, Susan.
You're welcome. And Clara, you've got this in a PDF, so this could be shared too.
Yep. Yeah, I was just about to say, I will follow up in my follow-up email from this meeting. I'll share this PDF so everyone has it and can take the time to look it over. And if you have any other questions, feel free to reach out to me. Or Susan, I can share her email as well. But yeah, if you think of any other questions, definitely feel free to reach out about it. And thank you, Susan, for coming in and sharing
My
this information
pleasure.
with us.
Great to join you all today.
All right, so next up on the agenda, I'm going to pass it over to Emily, and she's just going to give a brief recap. We had all 4 of our community workshops over the past week. We wrapped up with our last one on Tuesday in Portland. So I'm just going to have Emily give a brief overview of how those went, so people know. Thanks, Emily.
Thanks. Yeah, it was quite a wild week with all of these workshops. We were driving all around Cumberland County, and it was really fun. It was nice to get out to all those different parts of the county and speak with folks. Turnout was better at some places, depending on mostly the level of outreach that happened there. I think I'm looking at Amy, like she was super proactive in her outreach and brought in people from everywhere. And there were other libraries that I wish we had worked with a little bit more closely in identifying partner organizations that we could, promote through. I think the biggest challenge of this all was not promoting these digital equity workshops through the internet, because the idea was to bring in people who didn't have internet access. And so it was such a huge challenge to bring folks in. Most people said that they found out about the workshop through the newspaper ad that we put out. But Amy, in Bridgeton, we had a number of folks who found out through like the Chamber of Commerce and some other local organizations that you had reached out to. So that was super helpful. In Portland yesterday, or was it yesterday?
Tuesday.
2 days ago? Oh goodness. In Portland, this was actually really funny. We ended up making an announcement in the middle of the library about 10 minutes before the workshop. And that's where we got most of our participants from, which is very telling. But we luckily had, an English speaker and a French speaker, and so we did an announcement in English and then in French. And then there was this other guy who happened to be there who spoke in Angolan, or who spoke Portuguese, sorry. And so he stood up and translated just kind of off the cuff for us. So we ended up doing an announcement in those 3 languages. And we had, I think of all the people there, the number of immigrants, there were by far, that was the most in attendance, the highest in attendance, which is really great. That was our goal in Portland, knowing that they're the ones who A, use the library the most often, and B, have probably the most significant numbers of barriers to internet in the metropolitan area. So in the Portland area in particular. So we were really glad to have them there. They gave amazing feedback. We had one woman who, I forget the organization, but she worked as a resident services coordinator of some kind.
Mhm.
And so she gave really great insight on, the populations that she served, the tenants, the residents that, sorry, we don't use the word tenants anymore, we say residents. The residents that she works with, she was able to sort of represent their needs, which was really awesome. So we're happy with, the results. I think by the end, we had a more refined system for how to facilitate those focus groups. It was very clunky the first time around, but we sort of refined as we went, and ended up having, I think, what did you say the final number was, Clara?
It was 32.
Yeah, so
Collectively, yeah.
32 participants altogether, some of whom represented organizations who were, speaking on behalf of much larger populations of people. So we got some really good feedback and qualitative data to use from those workshops. And now it's going to be a matter of aggregating and analyzing that data, which is our next big challenge when it comes to the plan, because we have so much of it now. And we want to make sure that, everything that was expressed in those workshops is somehow integrated into the plan. And so that's, another way that we'll lean on you when we're drafting to make sure that it feels representative of the things that you heard and continue to hear. But otherwise, we're really happy with how they went. We had a lot of good food, a lot of pizza. I had pizza like 4 times last week for like lunch and dinner, which is pretty bad. And yeah, and just thank you to everyone who promoted and hosted in some cases, and helped with that. It's such an enormous effort, and we're really grateful for to have partners in this, because we definitely would not be able to do it as a single organization. So any questions about the workshops or other comments? I don't know if some of you were able to attend, or Deborah?
Hi. Yeah, you mentioned a couple different populations. Was there anybody at any of those 32 that identified as either having a disability or from an organization related to a disability?
That's a good question.
We did have someone at the Brunswick meeting who
That's
had to
right,
use a
yeah.
wheelchair. Yeah.
Okay.
Yep.
I sent it out to a lot of people, but I didn't follow up like to find out who might be attending. I just kind of, so I'm just curious.
And for those populations, that kind of leads us to our next agenda item, the stakeholder interviews. So I don't know if we want to move on to that, but does anybody have any questions or comments about the workshops?
Are there another round planned, or? will that be-
That's it for us. I mean, they're still going on across the state, I think, into this week and maybe even next.
Mm-hmm. Yeah.
But not in Cumberland County. So the Cumberland County ones are done. However, there are plenty of opportunities. If there was, I was just going to say, in regards to Deborah's point, if there are groups that we think we're missing, which we're going to discuss in just a moment, then we could do essentially a mini focus group with those groups. So with that, maybe Clara, should we transition to stakeholder engagement? Okay. So this is now an opportunity to pinpoint those populations that we're not capturing a little bit more or a little bit better. So Debbie is actually doing a lot of work with circulating surveys to well, I don't know how many you're actually going to end up doing at the luncheons, the Meals on Wheels luncheons, but that's a population, that's a group that that she's working on getting feedback from. I know, Deborah, if we wanted to, have a focus group on Mackworth for, if you wanted to do that, we could talk about doing that. There are lots of ways to sort of dig deeper into those populations. Yeah, Deborah?
Yeah, so via email, we're kind of in an email stage with MCA and DRM where we're like asking questions, but people are off. So I don't have any set answers on the stuff I'm going to share, but we are talking directly with MCA to work on not exactly statewide, but on a state level. My coworker is involved in the digital equity at that level, and we're talking about doing a focus group. So I think I mentioned this to Clara as well. So we're possibly going to be doing one, and maybe that means having you guys join us. Maybe that means just identifying in our meeting who is actually from Cumberland County. I don't have any details on when that will be or if it'll be during this deadline, but we are connecting to that. So that my thoughts are coming out kind of backwards, but if we have anybody in Cumberland that somebody here says, hey, this person would like to come and be recognized as a person with a disability and offer their input, they may be able to join that focus group. Even though it won't directly go into your data, it will still make sure their voice is heard as well. So I emailed and then I was off and then somebody emailed and they were now there. So that's what this week has looked like for this. So we're talking about doing one, and I can share that with Clara, and so it may not end up in this data, but it will be there. Does that come out make sense?
Yeah, totally. And Clara actually, the state did their own focus group at Portland Adult Education, and Clara sat in on it. So there are ways for us to capture that data as well for our plan. So if that is planned, make sure that we know about it, and then one of us will be able to hopefully attend and take our own notes and get that into our own data set.
Fantastic. Capture. That was the word I couldn't find. Thank you. I was like, there's a word that makes this all make sense. So I'm getting my Cumberland confused with my state level. And
yeah,
so,
I know it's very confusing because there are a lot of simultaneous efforts going on, but we're coordinating with them to make sure we know where they're going and how we can get their data, how we can share data with them, and vice versa. So if you have something going on, we might know about it, but in any case, just send us a calendar invite, and we'll try to attend ourselves.
wonderful. And like I said, it as well as if Clara, when I do send that, if you can share it with the group here, if there's anybody that wants to attend, we definitely want to capture them, capture their voice as well. So thank you.
Definitely. I see Jen put something in the chat about a senior luncheon tomorrow. I think that would be a great place to distribute surveys. And yeah, definitely feel free to print some if you want. We can always print surveys and I can drive them over, whatever works best for you. But I think that would be a great opportunity to capture input from older adults.
Yeah, the surveys are a little lengthy. So, with Debbie, I printed a bunch and I dropped them off at the library. Jen, if you wanted us to do that as well. So what time is it tomorrow?
So I believe it's 11 to 1. Unfortunately, I have my town budget meeting, so I'm not going to be there, but it's sponsored by Age Friendly Wyndham. So I know there's going to be stuff that we're sort of handing out, so I can print up a bunch. But yeah, if you want to provide me with a stack, I can have them here at the library too. That's, because I know you said through April, the survey, right? Yeah.
That's right.
So,
Yeah.
And
yeah,
I think, ideally we would have people take it online.
Okay.
But that's obviously there are barriers to that. So we want everyone to have a paper versions.
Mhm.
We just don't want to ask the libraries necessarily to cut down a tree to print
Right.
that many. So I know Amy put a little post, she stood up a poster that had what was it? Which one was it? Was it the survey?
So I took the description from the survey because the first page of the survey is actually this is what the survey is and this is why it's important to take. And so I just printed that first page and put it in a display. And then printed off like 10 copies of the survey and just had them available in a stack. But also had a little QR code that people could scan because a lot of people do have phones, even if they don't have internet or computers at home, they will have a phone. So we did that just as a display at our circulation desk.
Right.
I can-
And then also if they, if they wanted to ask for a paper copy, I don't know if you have if you would it be preferable to have a stack of like paper copies in the library, Jen?
I think for the folks that I'm thinking are gonna do it, I think they are more likely to do it on paper.
Yeah.
But I can, I can put a QR code in a couple of different places, like by our public computers, and at our circulation desk. But I think we always tend to have, when we have something that goes out digitally, like our newsletter or whatever, we have a few copies that people can just pick up because we know that doesn't reach everybody. So
Yep. Okay. Well, we are happy to drop some off to you if needed. I don't know that I'll be able to get there before tomorrow, but
well, for tomorrow, I can print up a few copies, and that's fine for tomorrow.
We could also
for
just
the luncheon.
We could print the poster that has the survey link on it.
Okay.
Yep.
Because then, you could print like 30 of those if you want, and that's just a one pager.
Okay.
Yeah, I also do have some time this afternoon and tomorrow morning, so I can always come and drop off surveys if you want a few extra copies. And just for when you talk to the Age Friendly Maine, is that who's
Age Friendly Wyndham is the one that's doing the luncheon tomorrow.
Wyndham. Yeah, I think just recommending, like, if people do fill it out, to just leave it, and then if you get it back to us, we can submit it online, but it can be tricky if people bring it home and then don't know how to mail it back.
Right.
So
okay.
Maybe just mention to them that when they talk about it, and if they're going to fill it in person, just to leave it at the library and we can pick it up.
Right.
Put them. Yeah.
Okay, so on that note, should we dive into stakeholder interviews, Clara?
Yes. Yeah, I think Deborah had
sorry.
Hi. Yeah. My question is because it's many pages and very long. Yes, we want people to fill out the whole thing, whether it's paper, whether it's online. If somebody can't fill out 12 to 14 pages of a survey, is there any way to identify, here's the top 10 questions we definitely want to hear from? I hate to abbreviate something so important, but 14, I would not walk to the library and pick up a 14-page survey and complete it without, I mean, it's because I say 14, it might be 12 to 14. I'm just thinking of, like, if somebody says, I can't do all that, if I can capture their information in the first 2 pages or something, is there a best 10 questions or something? I'm not being sarcastic. I really just want to make sure that we can get something.
I would say as many, like, definitely the first few questions are the most important. I think the later you go into the survey, the more nitty gritty it gets.
Okay.
So definitely the first, page or two, and also like the comment box where people can write more qualitative feedback. That's also important. So, but they don't have to answer every question for us to accept the survey.
Okay.
So as many as possible. But I think we're for our plan. So we're talking the statewide survey right now. For our plan in particular, I think we're more focused on getting our stakeholder interviews done at this point. And so that's where we're going to get more high quality data. So that's going to be more like quality, not quantity. the state survey, they just want as many folks to take it as possible. But our priority for completing our Cumberland County plan is to really get these stakeholder interviews done. So
Okay.
even if you identify one person that you could have an in-depth interview with, then that's great. We would love that. So I know that we've made some progress on some of the stakeholder interviews, and I think Claire and I just wanted to go through the list of covered populations to make sure that we are covering all of them, and that we have a game plan as to which one of us will be in charge of that interview. So I just wanted to share with you all first that you are all stakeholders and you can do a stakeholder interview, and that counts as one of your 2 interviews. So instead of us interviewing you all directly, we put those interview questions into a form that you can write your responses to. So thank you, Clara. And Clara just linked to it. And so if you would like to sit down with us and answer those questions verbally and have us record them, we can do that. If you would rather just fill out this form on your own time with your thoughts, you can even ask your coworkers if they have anything they'd like to include in those answers. So you could, have it be an organizational wide thought dump, I guess, into this form. But we just thought it'd be more efficient this way rather than sitting down with each of you. And we've already heard so much about the work that you do and the experiences you have, and also what you've, observed in the fields. But we thought this would be a lot easier if you all just were to take that information and put it into a form, and then we'll have that actual data to work with. Are there any questions on that?
Yeah, I had one. So we had, and maybe we can just put it into the form you shared, but kind of mid-April had planned to pull together a couple of staff members to do an interview together.
Okay.
Does that fall into the stakeholder interviews, and should we just do it all in the form and then try to pull together some community members from there for a second one? Or
Yeah, that's a really good question.
Yeah, just wondering,
So if you wanted to organize like an internal focus group in your organization, you can absolutely do that. And I would use this form to capture all of those insights, essentially. So if you could have a note taker who, is going through these questions, because it also serves as like a rubric for what we want to be answered. So you could use this form, ask the questions as written. You can have as many people in the room as you want, really, and then just make sure you're capturing sort of not verbatim, but like the high level, like key points of what people are saying in that focus group. And you could even take a recording of it in addition, if you wanted to, if you're worried about not capturing everything.
Yeah.
That's what Claire and I have done in some cases, is actually recorded it in case we need to go back later. But that is absolutely something that would be so helpful, and really would yield a lot of good data. So
Cool. So I'll make sure we're barking up the right tree there.
Yes, and then your second point too, if you want to do like a focus group with a group of people that you serve, is that right?
Yeah, we people are typically in the center, so it might be a good time to just maybe do a quick little focus group with them. So wanted to
and then so then that's a different form that we have.
Okay.
So we have one for like service providers and stakeholder organizations, which is what Clara just shared. And then we have a different one for if you're interviewing or doing a focus group with covered populations. So Claire, do you have that link as well?
Yeah,
Awesome.
just sent it in the chat.
So I hope that distinction's clear. The questions are different as far as how they're phrased and what we're trying to find out. So if you wanted to do both of those things, Nathan, that would be awesome. If you wanted to just do a focus group within your organization, that's fine. We can help, we can support in any, any way possible. If you just want to give us a heads up about when you might want to do that, we can offer technical support for those if
Awesome.
needed.
Cool. Easy enough.
Cool. Yes, but the easiest interview, like the lowest hanging fruit, is yourself.
Okay.
So you could even do your own, like Nathan Davis, I'm a stakeholder, I work for this organization. You can fill out that form yourself, and then you can do a focus group with so
Yeah.
you all as individuals are stakeholders.
Okay.
And we really want you all to fill out that form.
Okay.
Are there any
And did you say you
other-
wanted us to get 2 stakeholder interview forms finished?
We want, yes, so 2 total, but we want 1 stakeholder. So as in a direct service provider or other kind of organization, like a library director or somebody who works with these populations. So 1 of those, and then 1 community member.
Okay.
So within the covered populations.
All right, thank you.
Yeah, so just 2 interviews. Anything beyond that would be wonderful, but certainly not required.
And can you say again when those are due?
So we are actually we're going to start drafting our plan next week, but we can integrate these results as they come.
Okay.
I think ideally we would wrap up stakeholder interviews, by the end of next week, but that feels early. But again, it's just two minimum. So that's the ideal. If it trickles over, that's fine. We can still use it. We can still integrate it, but we want to get the bulk of them done by the end of next week or maybe the week after.
Yeah, that's doable. I have it 50% done. I just have to identify my community member.
Okay,
So
awesome.
I see the online version. Is there somewhere I could print 2 of the interviews? I thought I had it saved, but I'm looking for it right now.
Oh, for the statewide survey?
For the stakeholder interview.
Oh, yeah, we could. We don't have a paper version of those.
Do you know, I'm not sure, I can look into this, Debbie, but Emmy, do you know if you can get a PDF version of a survey from SurveyMonkey? I can probably get a PDF version and send those out to you all. And then those would probably be printable.
I think you can. I think that's pretty
Yeah.
doable. I've just never done it before, so.
No worries if not. I could probably bring my laptop and just do it online. So
Yeah.
Yeah, that might be easier for you because then you won't have to put it all back, you won't have to like enter it in afterwards. So, but if you just want to have like a paper copy of those questions, I can definitely send you a PDF version.
I think that's okay. And because I know Meredith wants to do one as well. So I'll just make sure she has the link and we
Okay.
can use the laptops. So thank you.
Okay, great. Okay, yeah, I know. Sorry, it's confusing because there are just so many different ways that we're trying to capture data. So thank you for bearing with us as we try to keep everything straight. But the community meetings are behind us. That is like a big check. We got it. Now we just want to complete the stakeholder interviews, and then we'll continue to promote the statewide survey through the end of May. So the next deadline is completing the stakeholder interviews. Any other questions on that? does everyone have, just out of curiosity, does everyone have somebody in mind that they'd like to interview as a community member? Maybe, I don't know, maybe you could just share, you don't have to share names, but like you could share who you have in mind.
So I'm sorry, I did have a quick question because I know you have a lot of balls in the air, and so I don't want to be like duplicative or anything, but is
Yeah.
it best to fill in the spreadsheet and you will go and find it there? Or is it best for us to email you like once we have things scheduled? Or both?
Either way, I mean, I think whatever is easier for you, because we can always fill it in on the back end. Yeah, if
Okay.
you lost the link to that spreadsheet, don't worry about it. Just email us and say, hey, I'm interviewing this person. This is the population that they're, that they fall under. And yeah, I think, and then we'll also see it come in because you'll submit the form. So whatever's easiest. Whatever works for you.
Okay, that's fine. And so I did reach out to Bridgeton Hospital, and the
Awesome.
VP of Nurses is getting together a focus group of nurses to talk about what they see from their patients in terms of technology use, and what their needs and barriers might be. And so we're scheduling that. So
Awesome.
you had just asked like who our
Yes.
intended state, and so that's my offering.
Okay, awesome. Maybe, Claire, do you want to just put that on the spreadsheet now?
Yep.
She has it open, so.
I added it actually, which is why I asked the question about if I need to.
Amy, you're so ahead of the game. Thank you.
Oh, you're welcome.
Okay, awesome. So that is that population. So would that, which covered population would that cover?
Well, so that was under rural healthcare, like you had that as a specific thing.
yes.
And so.
Sorry, I don't have them in front of me right now.
Yeah,
so.
no, that's okay. So I guess it would cover actually a couple of different populations because it's
Right.
like rural, but also aging and also disabilities. And so it will cover a couple of different things, I think.
Yeah. Okay, great. Well, thank you. Any other leads or ideas on community members that?
I have a community member who's a veteran. I was gonna approach him. He's a pretty
Hey, that's
active
awesome.
library user, so I was just gonna give
Perfect.
him a call.
Awesome. We love that. We love to hear that. Deborah, did you have an idea as well?
Yeah, I was gonna say, I mean, myself as a stakeholder, also as a person who's hard of hearing, but I'm not in Cumberland County, actually.
Darn. Do you?
But
you
I
work-
have
you
other
work in
people.
No, you work in Cumberland County.
Okay.
So it's live or work.
Oh, phew, okay. I thought I was like, I could walk across the street and then I'd be in Cumberland, but.
Yep. So you're
um,
good. If you
and-
live or work in Cumberland County, we want to hear that.
Perfect.
Yeah.
And then we have an individual with a speech disability that I will reach out to.
Okay.
I'm going to connect with.
That's great. Thank you. Nathan, did you have someone in mind?
I'd kind of alluded to it, but possibly doing one personally or with along with a few other staff members who are frontline folks serving the community. And then we have, just doing kind of an impromptu one with some of the youth that use the space for kind of like homework help and that kind of stuff.
Oh, awesome.
Getting some of the questions in there. So yeah, that's kind of the plan as of now.
Great.
And would you say, Nathan, the folks that you work with have, so I'm looking at the focus groups. Are most of them have language barrier?
Yes, particularly for some of the folks who use the space day to day.
Okay.
And then also for the community members that are directly served, particularly by our community health outreach team.
Okay. Perfect.
Okay, awesome. And then Debbie, she has a bunch of folks that she's covering already with the at the Meals on Wheels luncheon, which is awesome. I don't know, Debbie, do you think it'd be like possible to do a one-on-one interview at the luncheon, or is that?
Yeah, I think I'm going to Yarmouth on Wednesday, so we could definitely bring my laptop and see if anyone's willing. But I also know that Meredith works closely with community services, so they talk to like hundreds of clients a week. So I was wondering if she had particular people in mind. And
Yeah.
also, we have over 400 volunteers, and we have volunteers. Yeah, I was wondering, especially the ones who do some tech help.
Oh, my dad's one of them. Maybe I should just interview him.
Good idea.
That's awesome. Yeah, that's great. Whoever you think is you know, is best, and also whoever's willing to,
Right.
you know, participate. And that would probably fall under low and no income, right?
It depends. Sometimes the luncheon, it varies. But we could be more specific and, you know, for low income, for sure.
Yeah, okay. I mean, anybody who would like to participate, we'd love to speak with
Okay.
them. And then we can kind of figure out which covered population they might fall into
Okay.
after. Yeah. Okay, great. Any other ideas for stakeholder interviews I'm sorry, community member interviews? I actually did want to interview my parents. Claire and I decided that I should do that because my mom is a teacher. And so, she actually retired a year early because COVID was such a nightmare with internet. But also, yeah, my dad is he delivers meals for Meals on Wheels. So I don't know that he necessarily has a ton of insight into internet access. But in any case, you can really interview anybody from the community. Everyone really has a stake in this issue. I might even fill out a form myself because I've lost internet so many times this week. Oh, that's another thing too. You all can take the statewide survey. We're all community members who live and work in the state of Maine, so do that as well.
And so I'm sorry, I have another question sort of about prioritization, because I have Rachel, who's the outreach coordinator who does technology help, where she sits with people and offers them one-on-one assistance. And so I was encouraging her to have people fill out the statewide survey, but is it better for her to do the community member interview with that time instead? Because, you know, we don't have infinity time, but she does have time to help them do one thing or the other thing. So which thing is the better thing?
I would say probably if she's going to do this like on an ongoing basis, then the statewide survey.
Okay.
To stick with that, because we really only need one interview from a community member. So if you want to do one, with somebody that had a lot to say, she could certainly do that, but otherwise just continue helping people with that statewide survey, I think is the best way to go.
Okay, that's great.
Do you think that's right, Clara? Is that?
Yeah, definitely. And the only thing I would say is, like, looking at this spreadsheet, if you do see, like, you could share this with Rachel, and if there is like a section that we don't have a lot of representation from, and there's someone that she works with that she feels would be a good representative from that covered population, like, I think that could be a good person to use the other survey form for. But I agree with Emily, like, since it's like an ongoing thing, I think using the statewide survey makes sense.
And we'll be able to get that data as well, regardless. So that's why, when in doubt, fill the statewide survey out. That's sort of like a rule of thumb. Thanks, Nathan. Good to see you. All right, I think I think, do we have any right now covered populations that we have like nobody covering, Clara?
Let me look through. I think so. I know Bruce had to hop off, but I think we're still working to find someone from the incarcerated or formerly incarcerated population. So if anyone has any organizational recommendations, I know Jen, you said the lived expert that you're interviewing is a veteran. So if there's anyone that anyone else serves that was formerly incarcerated, they could be a good person to interview as a lived expert. So that's just one group I think we're still working to represent.
Oh, I thought we were not supposed to be doing that was going to be a statewide thing.
Yeah, so we can't interview currently incarcerated individuals.
Okay, I see.
But we can interview formerly incarcerated individuals or organizations that represent incarcerated individuals. It's kind of complicated, but
Okay. No, that's fine.
yeah.
I get it. Thank you.
Yeah, yeah, no, it's confusing. So I'm glad you asked that. And then the other one looking at this, the two others that I would say is affordable housing and unhoused. I know, Bob, I know Greater Portland Health works with Preble Street sometimes. So they're my roommate actually works at Greater Portland Health, and I know you have a lot of folks that come in that are unhoused. So maybe there.
Yeah, we certainly have that potential. And if I know that unhoused individuals are a priority for interviews, I can reach out to folks who work most closely with them to see if they can snag an interview somewhere along the way.
Yeah, that would be
Okay.
great. And an interview from a lived expert, so someone who is unhoused, or even, yeah, like you said, someone who works directly with that population, either one or both.
Okay.
Yeah, thank you.
Well, so in that vein, I mean, a number of our staff work with unhoused patients. I assume preference would be interview with someone who is or was unhoused, but if it came to it, we could be a staff member who is regularly conversing with them as well.
Yes.
Yes.
Okay.
Yeah.
And that's where you would use that stakeholder interview form rather than the community member interview form.
Got it.
So you could even circulate this survey link to all of those people on the staff who work directly with unhoused populations.
Okay, got it.
And then they could take it at their own, pace and whenever they're able to.
Okay.
Yeah.
And oftentimes we get really great feedback from direct service providers because they do work with the populations on just such a close and ongoing basis that we get, just really good feedback from them. So, and it's, I think having interviews, it's definitely more sensitive, right? Like interviewing somebody from the unhoused community. That's something that, unless you're a social worker, need to have some I imagine you're in that world. But I think you have to have just certain knowledge and expertise on how to conduct a stakeholder interview like that. So
Okay.
Again, when in doubt, go to the service providers who really can speak on their behalf.
Great, I can do that. I do have to run for my 1 o'clock meeting now. Apologies, but appreciate that.
No
help.
worries. We'll send everything in an email so
Okay.
you have those links.
Thank you.
Thanks for joining us, Bob.
Bye.
Bye.
Seems like a lot of people had 1 o'clock meetings, so, but I'm glad we got through everything.
Yes. Yeah. And that was sort of our priority today, was the stakeholder interview conversation.
Well, thank you. I'm sorry, I also have to go.
No worries. No worries.
Amy, and I'll share some of the data that we got from the survey so far. I'll share that in an email, and that might be a better format anyway for people to sort of process that information.
Okay, excellent. Thank you.
Thank you, Amy.
Thank you.
Bye, everybody.
Bye, Jen.
Again.
Okay, awesome.
I didn't know.
Everyone left. So funny.